If only there was a blood test that you could do once a year that could tell you if you have an early cancer. 2/3 of Americans are at risk for cancer, mainly because of obesity. This is actually the new epidemic that we're faced with. It's the weight gain epidemic. Of course, there's other epidemics going on top of COVID, but let's stick with this test that could change your life. This test is called the Galleri test, and it's a simple blood test, so it's a simple blood draw, and it's based on detecting circulating DNA material that would come from a tumor. So when you're a woman or a man, you should not have any free circulating DNA. DNA belongs, it's packed into the nucleus of a cell. Any fragmented free circulating DNA would actually exist only in two circumstances. A woman that's pregnant, who has DNA from the baby that's circulating in a bloodstream, and that's actually how this test came to be into existence, because the researchers realized, wait a minute, there are cancers in which we have free circulating DNA. So they started looking at this test. It's working hard to get approval by Medicare. Once Medicare approves it, then it will be available and likely get covered under your health insurance. However, for the time being, it's not covered. So yes, the cost is $760 or something like that, depending on what you want to do. Pay it all off at once, or you can pay a monthly fee of $60 for the duration of the entire year. You could do it once a year. You could do it every 2 years, depending on your risk. But just as an FYI, only 5 cancers have a screening method. Colorectal cancer has Cologuard or colonoscopy every 10 years. Breast cancer, mammogram. Cervical cancer with pap smears. Prostate cancer with a PSA level. And lung cancer by doing CT screening for people who are at risk, who have had smoking. All the other cancers that we're faced with, ENT cancer, bladder cancer, bone cancers, are not really screened by anything. And lung cancer is not frequently screened. There's all kinds of cancers that are not frequently screened. People ignore colorectal cancer screening. They don't go into the doctor very often. And they're like, oh, colonoscopy, 10 years. I was told it's okay, but it was 3 years ago. You can get cancer a year after your colonoscopy. Colonoscopy doesn't guarantee you're not going to get cancer in the next 10 years. It's just not done more frequently than that. We are having a special event, blood draw, where the company has brought in a phlebotomist in our office, and we have 5 available appointments for whoever would like to come in and get this test done. If you're over 50, you qualify for this test.